Assalamualaikum, my name is Nur Amni. I am 4-year student in medical physics at University of Malaysia. So, in today's video, I will explain about magnetic resonant imaging or common name which is MRI for the diagnosis of Parkinson disease. So, let's get started. I'm sure everyone is very familiar with Parkinson disease. But to what extent that do you guys know about it? Don't worry, I will explain it to you guys. Let's go. Do you guys know that Parkinson disease or PD is the second most common neurodegenerative disease after Alzheimer's disease? Parkinson disease is a disease that predominantly affects individuals older than 60 years old. So, as our population continues to grow older, more people are likely to experience it. People tend to think Parkinson as an older person disease. But do you guys know that some can get Parkinson at 40 or even younger?
Oh my God!
Parkinson disease is caused by a loss of nerve cells in this part of the brain called substantia nigra. Nerve cells in this part of the brain are responsible for producing a chemical called dopamine. Dopamine acts as a messenger between the part of the brain and the nervous system that help control body movement. If these nerve cells die or become damaged, the amount of dopamine in the brain is reduced. So, this means the part of the brain controlling movement cannot work as well as normal, causing movement to become slow and abnormal. Parkinson's symptoms can be divided into two types, which is motor symptoms and non-motor symptoms. There are four main of motor symptoms, which is resting tremor, slow of movement or another name bradykinesia, stiffness or rigidity, and lastly, changes in posture and trouble with walking and balance. For non-motor symptoms may include loss of sense of smell, sleep problems, constipation, and depression. Before we go into the next part, which is the diagnosis of Parkinson disease using magnetic resonant imaging, let's get to know first about the principle of magnetic resonant imaging. Magnetic resonant imaging or MRI is a non-invasive imaging technology that uses a magnetic field and computer-generated radio wave to create three-dimensional anatomical image. MRI is often used to view the brain and surrounding nerve tissues for disease detection, diagnosis, and treatment monitoring. Positron emission tomography or PET already has shown a promise as an early detection tool for Parkinson. However, the test is very expensive and involves giving people a dose of radiation, whilst conventional MRI cannot detect early signs of Parkinson. Due to that, in June of 2014, a researchers from Oxford University, funded by Parkinson's UK, have developed a simple and quick MRI technique that offers promise for early diagnosis of Parkinson disease.
Wow!
Early symptoms of Parkinson are subtle, which makes an accurate early stage diagnosis very difficult. Scientists need to find a good tools to identify people as early as possible in the course of the disease, which relatively inexpensive and widely available. Therefore, a new MRI technique called resting state fMRI, which focuses on scan of a part of the brain known as basal ganglia, could improve the lives of countless patients with Parkinson. The team demonstrated that their new MRI approach can detect people who have early stage of Parkinson disease with 85% of accuracy. Before we get to know what is resting state fMRI, let's get to know first what is fMRI. Functional magnetic resonance imaging, or fMRI, is an advanced MRI technique that measures brain activity by detecting changes in local blood flow that are coupled to neuronal activity when a specific task is performed. The procedure is similar to MRI, but uses the changes in magnetization between oxygen-rich and oxygen-poor blood as its basic measure. Now, we already know about fMRI. Then, what is resting fMRI? A bit confusing, right? Don't worry, let me explain. Resting state fMRI is a method of functional magnetic resonance imaging that provides a non-invasive method of assessing changes in resting state functional connectivity across brain region in patients with Parkinson disease. These resting brain state conditions are observed through changes in blood flow in the brain, which create what is referred to as blood oxygen level dependent, or in short, both signal that can be measured using fMRI. First, patients just required to stay still in the fMRI scanner. Then, the doctors will examine the strength of the brain network linked to the basal ganglia produced from the fMRI machine. Generally, the doctors will look at the connectivity or strength of brain network in the basal ganglia, which is part of the brain known to be involved in Parkinson's disease. Usually, Parkinson's patients will have a low connectivity of brain networks. The advantage in using fMRI is, first, it is non-invasive and doesn't involve radiation, making it safe for the subject. Second, it has excellent spatial and good temporal resolution. Third, it is easy for the experimenter to use. However, the disadvantage of using fMRI is the patient has to stay still to capture a clear image. Patient movement can affect the quality of image. There is currently no cure for the Parkinson's disease, but don't worry, if you notice that one of your family have developed some symptom of Parkinson's disease, they can go and check the doctors for the diagnosis first, so that the disease can be diagnosed as early as possible and seek for treatment that can reduce the symptoms. Therefore, the life of countless patients with Parkinson could be improved so that they can maintain quality of life for as long as possible.